Hello, everyone, and welcome to the Health Channel, all health, all the time. I'm Andrew Schmartz. This hour, I'm joined by Dr. Jamie Flores. Dr. Flores is a plastic surgeon affiliated with West Kendall Baptist Hospital, part of Baptist Health South Florida. Today, we are discussing cosmetic surgery in the age of selfies and the worship of youth and appearance. Cosmetic surgery is definitely here to stay. The American Society for Plastic Surgeons says, quotes, patients are captivated by instant improvements to the face. It's evident in the popularity of apps and filters that change how we can shape our faces. And it predates Photoshop certainly by centuries that people are always chasing the fountain of youth. Miami is one of the capitals of plastic surgery, so why don't we start by asking what today are the most popular voluntary plastic surgery procedures?
Thanks for having me. The most popular plastic surgery continues to be liposuction. Liposuction pretty much has been the main surgery for cosmetic for decades. Whether it's in the chin, the back, the rows that you don't like, it's been the most popular. Second to that would probably be any type of breast surgery, breast augmentation, lift reductions, and then followed by probably an abdominoplasty or tummy tuck is what they call it.
So people are still getting tummy tucks in. Liposuction, it's important to note, is not about weight loss, correct?
Correct. Liposuction is not at all about losing weight, even though theoretically you'll lose some weight because we're actually removing the fat that gives you some weight to yourself. It's a body contouring procedure. It's removing the fat that's unwanted. It's removing the fat to give you a little better contour to your shape. And theoretically, you lose a little bit of girth and circumference, so you'll come down a few sizes in your garments. But it's definitely not a weight loss procedure.
And body contouring is kind of the buzzword here for a variety of procedures, and we'll talk about it a little bit later, but it's small improvements that a lot of people are looking for, right? Not major ones. There are some that are major improvements, but sometimes it's just kind of fine-tuning the edges.
Correct. What we look for when we do body contouring is smoothing out the rolls around the bra line, taking out that unwanted fat that hangs out over the pant line. Some of the women don't like the fat inside the inner thighs, so it's removing just the right amount to give them what they want without causing harm.
And you mentioned women, but men are more and more going for plastic surgery.
Yes, so over the last decades, again, men are realizing that cosmetic surgery is not just for women. Men are often getting nose jobs, facelifts, and even liposuction the same way. They want to get rid of that unwanted fat that really is hard to get rid of with diet and exercising, and that's that back fat. They're also going contouring procedures where they want to get those six-pack abs.
We'll talk more about six-pack abs in the doctor's office. I'd like to say that six-pack abs begin in the kitchen, but if that doesn't work, go to the doctor. Facelifts are still very popular, and we're going to spend a little bit of time on that, correct?
Yes. So facelifts are extremely popular in the age now where many people are receiving weight loss procedures such as bariatric surgeries. And again, more people want to look youthful, younger. Traditionally, facelifts were done in women or men in their 50s and 60s. Now they're being performed much earlier in the 40s.
And we have a picture of a graphic of a woman's face, and you can take a look at the procedure she had done. Tell us a little bit about what you see she had done here.
So she appears to be either in her 50s or 60s. The first photo on the left, you can obviously see that there's some wrinkles above and below the eyes, a little bit of fat pads that are herniating through. She's got a deep, what we call a nasolabial crease right between her nose to her lips. And she has a lot of excess skin, what we call the jowls, right next to her mandible, her jawline. So she appears to have had upper and lower lid surgery, which basically took out her excess bags, both skin and fat, and she had a facelift where her cheeks look much more rejuvenated. Her nasolabial crease is less intense, and her neckline looks a little better, a little sharper.
Well, how do you do the neckline? Is that part of a facelift?
Yes. So the neckline is twofold. what you want to do is address the deep musculature. So the deep musculature needs to be tightened. Oftentimes when we age, the muscles separate and release, and you want to reestablish what they were prior to that happening. So you want to attach the muscles in the anterior midline, and then pull them back posteriorly and up. As we age, the face
Gravity takes over.
Gravity takes
Right.
over. We droop, we come down, and we want to reestablish all that with sutures internally. So that's the one part. The second part is pulling back and removing the extra skin. And again, it's in the same direction as you tighten the muscles. So the pull is up past the ears and behind the ears. So the incisions wind up being hidden in the contours around and behind the ears.
We're going to go to the phones in a moment, but you had mentioned that younger and younger people are having facelifts. Why do people in their 30s need a facelift?
Well, in the 30s, if you were to come to me and you're interested in a facelift, the first point of interest is, why? Have you lost a ton of weight? And I think in the age of our society being obese, more and more people are seeking weight loss procedures. And that causes an excessive amount of skin laxity. So in their 30s, they lost over 100 pounds. You have all this loose skin, almost like a Shar-Pei, where you need to remove it. And the only way to remove it is really through a facelift.
And other parts of the body too, right?
Correct.
You can remove the skin after major weight loss of about 100 pounds or so, and many people have seen those pictures. All right, we have Barbara on the phone right now. You're going to go for a facelift in a couple of weeks. Why, Barb?
Well, good morning. Well, I'm a woman of a certain age, and for me, I've chosen to get a face and a neck lift. So along with that, it's been suggested that I have a full face CO2 laser resurfacing at the same time. Sounds awful painful. How do you feel about that?
Hi, Barbara. Thanks for calling in. That's actually a very popular procedure. You can do it at the same time, or you can do it separately with the skin laser resurfacing. Oftentimes people come in and we do a full face, and sometimes they're a little hesitant about either doing the eyes or not the eyes or the skin surfacing. In the right hands, it's very safe and the results are very good. In one part,
And
you're
what's
addressing
the downtime on that?
the downtime depends. It's roughly about 10 days. Facelift in general, they don't really hurt. They're a little bit sore, a little bit painful. You can feel the tightness in your face. But I would say most of them don't really have a whole lot of pain, and you can treat the pain almost with Tylenol or Motrin.
And it's okay to have multiple procedures at once today?
It is, and again, that depends on the practitioner. Someone who's safe and is experienced, which is very key, can safely do those procedures together. By doing and adding the skin resurfacing, you're addressing the fine wrinkles and tightening of those collagen bundles that can be addressed with surgery alone.
So what questions should someone like Barb ask the doctor when she walks into the doctor's office, and what questions should he ask her about her medical condition?
That's a very good point. You should first ask your surgeon how long he's been in practice. That's a good determination of the experience he has. How many surgeries has he performed specifically to what you're having done? Another good question is where he performs the surgery, and is that place accredited? Does it have a good track record?
Is it important to have it in a hospital, or can you have these procedures as outpatient, or I guess within an office environment where you stay a few hours after the surgery?
That's good. Most of these procedures are actually outpatient. I would say 99% of them are outpatient, and whatever center or surgery center you're operating out of should have a very good track record, should have a backup plan in case something does happen, very experienced anesthesiologist and a team. So these procedures are outpatients. They can take anywhere between 3 to 5 hours, very minimal blood loss, and usually the practitioner will see the patient the next day or 2 days.
Barbara, is this your first cosmetic procedure that you're having done?
No, a long time ago, I guess when I was in my 30s, actually, I actually had my eyes done because I had the upper lid that came over, made me look a lot older than I was. But, yeah, now it's definitely time.
Do you have any apprehension about it? Are you nervous, or are you obviously you're
No,
looking
I'm
forward to it?
excited. I can't wait. I just can't wait. I'm really excited. I've known a girlfriend of mine actually has gone to him many times, and multiples of her friends. So I know he does it for about 15 years. And so I've done all my due diligence just to make absolutely sure, that I'm safe and I'm going to the right person, because I know, just like the doctor said, it's real important. You got to do your homework.
And you've managed your expectations, because that is an important
Absolutely.
point. Patients come in with photographs of celebrities that they want to look like, or they want to look 30 years younger when that's not possible.
Absolutely.
Yeah, exactly. No.
Absolutely.
Yeah.
That's one of the most common things we see, and first and foremost I explain to them that that's a still photograph of someone else. It's very hard to
And likely
make,
photoshopped.
right, correct. It's very hard to make you look like someone else. I've had a set of twins who wanted facelifts, and they did not want to look different. They both wanted to look rejuvenated, and it's a tough expectation to accomplish.
Okay, a lot more to talk about. We'll be back here on the Health Channel, still ahead.
CAR T-cell therapy is a revolutionary new treatment for cancer. Healthcare companies developing CAR T immunotherapy use Thermo Fisher's Dynabeads technology to isolate, activate, and expand T cells that have been genetically engineered to recognize and fight cancer cells.
We're taking the patient's own cells and enriching those cells to fight the cancer.
For more, go to thermofisher.com/CTS.
Emily is thinking about taking a dietary supplement. She knows she should try to get her vitamins and minerals from the food she eats, but she doesn't always have the chance to eat right. And with more than 50,000 dietary supplements on the market, like a lot of other people, Emily has questions. Like how much vitamin A is good for you and how much is too much? If something's natural, doesn't it mean it's safe? Can folic acid prevent birth defects? Should we be taking calcium and vitamin D supplements? Luckily, there's a place everyone can go for answers. It's the website of the Office of Dietary Supplements. We're part of the National Institutes of Health, and since 1995, we've been conducting, funding, and evaluating research that we use to educate the public, giving Emily plenty of information she can share and discuss with her healthcare providers. We're ODS, for what you need to know about dietary supplements.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
And welcome back to the Health Channel. I want to invite you to check out our website, allhealthallthetime.com. On that site, we'll have a whole bunch of information about what we're talking on this show and on previous shows. And most importantly, that's your opportunity, one of the opportunities to connect directly to doctors here on the Health Channel for future shows. So you could submit your questions, and if you have topic ideas and some ideas that you want to learn more about. We'd love to hear from you as well. We're speaking with Dr. Jamie Flores about cosmetic surgery procedures. In 2017, eyelid surgery was #1 on the list of most popular cosmetic surgery procedures, followed by buttock augmentation or butt surgery. Butt surgery, doctor? What goes on in butt surgery?
Well, there's quite a lot that can go on in butt surgery. So butt surgery can entail a combination of liposuctioning around the buttocks to give a better shape and contour, and it actually makes the appearance that your butt looks bigger. Probably the most popular procedure for a better looking buttock is injecting fat into the butt, which is commonly called a BBL, a Brazilian butt lift. It's a very popular procedure throughout the world, specifically in South Florida, where people travel from other parts to come. And it's essentially taking fat from other parts of your body and injecting it into the buttocks to give it a better shape, a little more volume. Also can improve in the cellulites.
What can be done about the eyes? We all have bags that develop because nobody is sleeping, stress, they get bags, they get rings around the eyes. That's often the first sign of looking older. Where do you direct people who come in and need help with their eyes?
Well, the eyes are clearly the key to the soul.
And we'll take a look at, I mean, that was a terrific shot, by the way. If we can go back to that, the before and after of the woman with the eyes, if we had it. But you saw there the dramatic improvement.
Yeah, so she had a very typical extra skin, little herniation of fat. Just makes her look really, really tired. Looks more aged than she really is. And so she had basically her skin excised from her uppers, which is a very easy, low risk procedure. And then she had her lower eyelids tightened. You can tell she went from having wrinkles to no wrinkles at all. Most likely she also had what appears some skin resurfacing because her skin very smooth compared to the before photo.
Is Botox considered a cosmetic procedure? I guess it is, right? It's not surgery, and it's minimally invasive.
Correct.
And
Botox
is temporary, correct, but helps with wrinkles.
Right. Botox has been around for a long time. Botox has been used to treat medical conditions such as spasms, and then of course
it's a form of botulism, right?
It's a form of botulism. Basically, it paralyzes the muscle, and what people have realized that if it's good for certain parts of the muscle, why not get rid of the wrinkles? So Botox is extremely popular. In our office, we do Botox almost every day. We inject it into the forehead to smooth out the wrinkles of the forehead, and in around the eyes also to get rid of those, what they call the crow's feet, those little wrinkles outside your eyelids.
We mentioned contouring. That's kind of the thing that's really in. What are some of the contouring procedures other than liposuction that people are now doing?
So when we talk about body contouring, we're essentially taking out skin, sometimes restoring some volume. So in the face, let's say body contouring in the face is a facelift. It's very straightforward. Breast lift or breast reduction is essentially moving the components that have been sagging for a while up into the more proper parts where they were when they were 16. Tummy tuck takes out the extra skin from your belly. Very popular after having a couple kids, where the kids have caused stretch marks, have distorted your musculature. So we actually tighten the muscles via tummy tuck and then take out the extra skin. You exchange that procedure for a scar in your lower abdomen, and we try to conceal that scar inside the bikini line. Now, body contouring continues onto the back, where you're taking out rolls. So you can do it via liposuction or direct excision. And again, when it comes to cosmetic, we all want to hide our scars where you can put garments and they're not so seen or so unsightly.
Everybody's also interested in as many non-invasive procedures as are available. And a couple of years ago, Cool Sculpting, which is a brand name, I believe, of a procedure, was very popular. Where do we stand now with Cool Sculpting, and what are the alternatives with that?
So Cool Sculpting definitely was one of the first non-invasive procedures that you can do in the office with minimal downtime, where essentially you froze the fat. The fat would freeze, die, and your body would absorb. We've come quite a ways from that technique where more people are using heat type of reduction properties where you burn the fat and at the same time it tightens the skin. So I would say more people are moving forward from cool sculpting to these laser or heat treated devices.
It's important to note that of these surgeries, they are surgeries and there are risks. So before surgery, how should a patient prepare, whether it's a facelift or whether it's liposuction or any of those procedures?
So yes, surgery carries risk. All of them carry risk. The most important part that the patient can do prior to surgery is be healthy. So make sure that you're exercising regularly, that you can withstand anesthesia. If you're a smoker, you need to stop smoking. Smoking really causes the incisions not to heal, and you can have dehiscence and wounds. If you're a diabetic, that your sugar is well controlled, and that's working with your primary care doctor. So being a diabetic or a smoker is not a contraindication, but that needs to be controlled. You don't want to increase your risk of
infection,
already basic risk with comorbidities.
A lot of these procedures, like is a facelift, are you under anesthesia or are you awake during many of these procedures?
You could do both, actually. So where I trained at Johns Hopkins, we did all of our cosmetic procedures with sedation, local.
And sedation is not being put under.
Correct. Sedation is basically you have an IV and they're giving you medications through your IV. So you're, in all essential parts, you're asleep, but you're not intubated on a ventilator. But that requires a very, very experienced person giving anesthesia. We had a phenomenal person at Hopkins. Here, I do most of my procedures under general, where you're intubated and it's a controlled environment. But I think it really depends on the anesthesia personnel.
And after surgery, very important to follow the directions.
Yes, extremely important. Now, plastic surgery, we're like contractors. We all are going to have different tools and different ways that we do the same thing and achieve the same result, but we all have our little nuances. So each surgeon is going to have his or her own protocol. I tend to use a lot of local and block the nerve, so the pain afterwards is minimal. I see the patients after facelift the next day.
And you said facelifts are not terribly painful.
Not terribly painful. They're a little bit sore. I would say most of the people complain of wearing the wrap that you have to have for the first 24, 48 hours. It's really tight, it's uncomfortable. You can't eat. Most of them are just drinking liquids the first 2 days. The pain is a little bit behind the ear, and that's where we're really pulling and tightening the deep structures.
And the recovery time obviously takes, depends on what the procedures are, but how often do people return to work within the next day or 2 days, 3 days? I know people having facelifts sometimes go, at least in the old days, the Hollywood stars would go hide away for a month or two.
Correct.
I don't know if that's still the case.
No, that's not the case anymore at all. I think, several decades ago, the facelifts were very, very invasive and long. I mean, I've had my own colleagues doing procedures for 10, 12, 15 hours. The longer you have surgery, the more you swell, the more you're going to bruise. In general, facelifts, within a week, the bruising is already dissipating. The swelling is minimal, and whatever sutures or things that need to be removed are removed. Certainly within 10 days, they can put makeup and return to their work. It's a much quicker recovery.
Let's talk briefly about the six-pack abs that men are doing. What exactly is this?
So it's a very popular procedure for men. They still want to look very masculine, and so instead of causing what I call the Jillian Michaels curvature for the women, they actually want their indentations back. They want their ripped abs back. So what we do is liposuction the whole entire
You're assuming
abdomen.
that they had them in the first place.
Correct.
Though. Okay.
Right. Or sometimes we can actually create them. Again, you have to choose the right person. Someone who's really overweight, that's not the
That's not
procedure
gonna work,
for them.
right.
what we want to do is accentuate what they have. So we liposuction the entire area flat, and then you can kind of feel the inscriptions, the divisions of each rectus muscle, and we get very aggressive in those inscriptions, almost very superficial, so that skin tacks down to the muscle.
And it lasts?
Yes, as long as you maintain your exercise and eating habits. If you gain weight, what happens with liposuction when you gain weight is you'll gain weight in other areas that weren't liposuction.
Interesting.
So you may gain weight in your arms, your legs.
Fat has to go somewhere.
Correct.
Okay.
Correct.
All right, so stay with us. If you have a health question, you could email us at askthedocs@healthallthetime, allhealthallthetime.com. Ask the docs at allhealthallthetime.com. Send us some emails. We'd love to hear from you. After the break, we will continue our discussion on cosmetic surgery and how to have a healthy recovery and outlook. Stay with us on the Health Channel.
CAR T-cell therapy is a revolutionary new treatment for cancer. Healthcare companies developing CAR T immunotherapy use Thermo Fisher's Dynabeads technology to isolate, activate, and expand T cells that have been genetically engineered to recognize and fight cancer cells.
We're taking the patient's own cells and enriching those cells to fight the cancer.
For more, go to thermofisher.com/CTS.
Emily is thinking about taking a dietary supplement. She knows she should try to get her vitamins and minerals from the food she eats, but she doesn't always have the chance to eat right. And with more than 50,000 dietary supplements on the market, like a lot of other people, Emily has questions. Like how much vitamin A is good for you and how much is too much? If something's natural, doesn't it mean it's safe? Can folic acid prevent birth defects? Should we be taking calcium and vitamin D supplements? Luckily, there's a place everyone can go for answers. It's the website of the Office of Dietary Supplements. We're part of the National Institutes of Health, and since 1995, we've been conducting, funding, and evaluating research that we use to educate the public, giving Emily plenty of information she can share and discuss with her healthcare providers. We're ODS, for what you need to know about dietary supplements.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
Welcome back to the Health Channel, all health, all the time. I'm Andrew Schwartz, joined by Dr. Flores. We're talking about cosmetic surgery, and we're talking a lot about facelifts, and we have a biodigital graphic here of how a facelift works, as well as some of the risks that can occur when you have one.
Correct. So if I can point out exactly what's done. I'm going to go to the monitor.
Okay.
So we're going to point out what we tighten doing a facelift via the deep structures. The first thing we do is, this is the platysma muscle. It's a very big fanning muscle. Actually, cows have the strongest platysma muscle because they're chewing all day. So they're very strong. As we age, this muscle separates and dehisces for all the motion. So we make a small incision here, right underneath the jaw, and we actually tighten this muscle all the way down to about your thyroid cartilage. And we elevate the skin, just the skin, all around the entire face. We don't go past the lip structures here, and we don't go past the eye, because those are where the nerves become very superficial and you can damage them. Then we come to the back. We go behind the ear and we elevate, so there are two surgery areas meet. Now you see there's nerves that control your lip motion. So we'll be careful not to be so deep so that we can injure those nerves. And then along this vein here is another nerve that controls the sensation to your ear. All right, so we're very careful not to injure those. That's probably the most common risk of surgery, is damage to that nerve, which causes numbness to the ear. So in women, when they're blow drying on hot, they can burn their ear. Again, the structures down here, we tighten these muscles superiorly because all that sagging down. Sometimes this little yellow stuff is fat herniation from the cheek. Sometimes we trim those or tighten them not to lose the volume. Again, the other pull, since we tighten anteriorly, the pull is posterior, behind the ear, and up.
Is there a risk of too much tightening, or do people feel that they're too much tightening and there's a little loosening afterwards? Is it like when you buy a new shoe?
That's a great point. So there is too much tightening. I tell my patients, you don't want to look like you're in a wind tunnel, right? Because I personally can't even create that type of pull. You want a natural, rejuvenated, healthier look. Maybe take about 10, 12 years off your aging process. So we pull up and posteriorly the deep structures. I think there's not too much pull to that. But the skin pull should be a natural pull. It shouldn't be over tight. You shouldn't have to put your shoe on the OR table to tighten the skin.
Tighten the skin. Do facelifts help like double chins? I've been seeing commercials on new drugs to treat those.
Correct. So there are a lot of non-invasive procedures to treat the double chin. The non-invasive ones are injectables where it's dissolving the fat. There's some heat-related devices that you can put in these areas. Again, will tighten and shrink the fat. And then if that doesn't work, you go back to traditional with a small incision here and basically liposuction the fat, and then you wear a head wrap.
Okay, after our friend has all this surgery, how long is the recovery time for him?
So recovery, like I said, it varies per patient. I would say roughly 10 days, most people can get back to work. Within 7 days, they look pretty good and feel pretty good. So if the surgery's done on a Friday, they have that weekend, the full week, and a full weekend to recover. And most will have a little bit of bruising around the jawline, maybe around the eyes, but that's about it.
Okay, come on back over to the desk and we'll continue our conversation. That's terrific. It's a very good explanation because I don't know, I mean, when you talk with patients, do you show them some things like this to kind of talk them through the procedure? And generally, do patients want all of that, or they say, don't tell me anything, just let's do it?
I would say that most patients don't want to hear the deep particulars of what we're tightening and how we're making the incisions. Clearly, they absolutely want to know the risk. And I explain to them specifically, risk of bleeding is the number one. The face is very, very vasculature. Men have a higher incidence of bleeding because we have hair. So that oozes a little bit more. They usually have my cell phone. They call me directly. The other risk with the nerve injuries, it's just something to watch out for. If it happens, usually it's transient and the nerve comes back and it's not an issue. But you don't want them to accidentally use a blow dryer and burn.
I want to shift gears a little bit on plastic surgery because we're talking about the plastic surgery that is voluntary, but plastic surgery, I understand, really got its start in helping people recover from deformities, from surgeries that they had, removing body parts, and that is part of your practice as well.
Correct. So that was our initial practice. You're talking about centuries ago. Plastic surgery got its start with cancers or diseases that would eat away at people's flesh. And to reconstruct that area, people use different techniques, local skin, local products. You know, I'm sure they used farm animals way back. But it really got our start from
because
that
they're treating things like syphilis, where body parts were removed. There was a show I watched, The Nick, which talked about the first nose reconstruction, and very rudimentary. I'm not sure anybody would really want it, but that was a breakthrough back then.
Yeah,
and
actually,
changed people's lives.
I love The Nick. The Nick is a great show, but
it's about, to give you an example, it's about a fictional, I believe, New York City hospital, the Knickerbocker, which was based on a real hospital in about 1900 or so, I think.
Correct. And actually, I believe the surgeon it was based out of eventually came to Johns Hopkins and started our residency program. But it's true. You know, the nose procedure was one of our first well-documented procedures in plastic surgery, dating back to India, where either it was a disease or a cancer where that nose was completely removed, and they used either the skin from the forehead or, in the Knickerbocker, skin from the arm to reconstruct that area.
Breast reconstruction is obviously a big deal because it helps women get treated in the first place for cancer, and you do a lot of breast reconstruction.
Yes.
How has that changed over the years? Because it really has.
Breast reconstruction, it's very dear to my heart. I am both on a professional and a personal level. I've had my mom and my aunt have had breast cancer, and really I got into it because I wanted more for my breast cancer patients. It wasn't just about giving them something that they could hide in their bra or clothes. It was about restoring their function, sensation, the look, minimizing their scar. It's changed a ton from 30, 40 years ago to where we are now. We're able to reconstruct the breast with your own tissue. We can connect the nerves to give you sensation back. We can make them look really, really good, symmetric, with minimal scars. The old scars of having it from your chest to the axilla are really minimal these days. We can create really a minimal scar that's hidden with your tattoo after the complete reconstruction is done.
And there's reconstruction for a lot of other things, for people who have cancer, who have facial deformities. And I'm wondering if you hear stories that makes the decision or makes the pain and the emotional pain of that treatment going through it, that they could have reconstruction easier to some extent.
It does. It does. You have to combine both the psychological as well as the physical pain that goes along. The fact that reconstruction has come a long way, we give them a sense of hope, and that's almost half the battle. And to restore someone's smile, to restore someone's defect where you can barely notice their scar and they can get back to society as a norm, that's a huge benefit. That's
a huge benefit. Tell me some of the patient reactions after the cosmetic surgery procedures. What patients tell you about their life improvements, with the understanding that the surgery is not going to solve all of their problems.
Right. So you have to really, again, manage their expectations in the beginning. Most of the patients are a little hesitant, to be honest with you, regardless of what cosmetic surgery. And then once they achieve their results, it is night and day. The smiles on their face after the recovery, the confidence, the appearance, they're much more proactive in their lifestyles. They're happier in their job. It's amazing how that can transform someone.
It could really transform somebody, and it helps if you're helping reconstruction as well for cancer treatment. It transforms people's lives.
Yes, oftentimes the breasts before they start from the cancer treatment aren't ideal. They've either had kids. Most of the cancer patients are in their 30s, 40s, 50s, and they get a chance to basically reset their breast to the point where they're 16, 18. most of the reconstructions are perkier, lifted, and that's a permanent process. We do a lot of internal procedures to give them a internal almost support bra, which you don't normally have.
Do you have couples come in? A woman will have a procedure and her husband will have something done?
Absolutely, absolutely. I think most husbands appreciate the care that we give to our patients. It's very personalized. And then once they see like their wife has gone through it successfully, relatively pain-free, they're much more eager to get in and have maybe some liposuction.
And do people come back for multiple procedures? And where do you draw the line?
So for breast cancer reconstruction, so Bill Clinton passed a law in 1998 where mastectomies are covered. The reconstruction after mastectomies are covered for the duration of the person's life. So the insurance can't deny. So, and whatever symmetry they need is always covered. And as a practitioner, you have to judge whether or not putting the person under anesthesia, the risk of anesthesia outweighs the deformities that are occurring.
Okay, doctor, coming up, we're going to talk about the controversial issue of medical tourism and going overseas for cosmetic procedures. Stay with us on the Health Channel.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
Emily is thinking about taking a dietary supplement. She knows she should try to get her vitamins and minerals from the food she eats, but she doesn't always have the chance to eat right. And with more than 50,000 dietary supplements on the market, like a lot of other people, Emily has questions. Like how much vitamin A is good for you and how much is too much? If something's natural, doesn't it mean it's safe? Can folic acid prevent birth defects? Should we be taking calcium and vitamin D supplements? Luckily, there's a place everyone can go for answers. It's the website of the Office of Dietary Supplements. We're part of the National Institutes of Health, and since 1995, we've been conducting, funding, and evaluating research that we use to educate the public, giving Emily plenty of information she can share and discuss with her healthcare providers. We're ODS, for what you need to know about dietary supplements.
CAR T-cell therapy is a revolutionary new treatment for cancer. Healthcare companies developing CAR T immunotherapy use Thermo Fisher's Dynabeads technology to isolate, activate, and expand T cells that have been genetically engineered to recognize and fight cancer cells.
We're taking the patient's own cells and enriching those cells to fight the cancer.
For more, go to thermofisher.com/CTS.
Welcome back to the Health Channel. We're talking about cosmetic surgery, and now we're going to talk about leaving the country for cosmetic surgery. It's called medical tourism. It's been a growing trend, but there are some real risks you may face, even if the costs are less. And so let's talk about that a little bit. you know, people who say they want to go sit on the beach and have a couple pina coladas, and then they want to have medical surgery. And we have a little slide here to talk about what the risks are and exactly what medical tourism might be. So walk us through whether this is a good idea or not.
Well, it's a huge growing issue in the United States. I mean, there's a reason why the U.S. has such high standards when it comes to medical practice, credentialing our surgeons, our facilities. And so when you leave the safety of that environment to go somewhere else, and I've traveled the world, I've done surgery all over the world, I've seen it firsthand, the facilities, the sterility, the procedures being performed, and it's quite scary.
And you don't know about the doctor's accreditation.
Correct.
Where they learned it, all of that.
Correct. So that you put yourself in a huge disadvantage, all for the price, you know. And I tell my patients, you know, I would rather lower my prices than to have them go overseas and suffer, you know, the worst complication being death, which we've had several. I've had several patients come back.
Yeah,
dead.
have you tell us about that a little bit. What have the patients done and then turned to you to fix it?
Right, so I usually, when they have gone overseas, I wind up getting a call from the ER where the patients are, you know, febrile, fevers, sick. I mean, they are what we call septic, where their whole entire body is infected, and they often need emergent surgery to release all the pus, to control what's going on, and then the deformities are permanent. I can only try to help minimize the deformities later, and it's much more costly for them.
At the end of the day, they didn't save any money. They put their health at risk, and it costs them more. There's also, you have to be careful of that here in the United States, of people without licenses practicing everything from Botox to liposuction.
That's correct. So, you know, we say about, you know, overseas and other people having lack of credentials, but in the United States, we have everyone doing Botox, from family practitioners to podiatrists. I mean, you name it. Not to say that they're not qualified to do it. There's some training procedures they need to go through, but we also have people doing breast augmentations that are dentists. You know, there's a reason why we train, and we have a long training program, and there's a number of cases that we need to perform before we get credentialed.
What is the best way for somebody who is looking for a plastic surgeon to find a reputable one and a good one who will not do them any harm?
I think you start with where they trained. I think not all training programs are the same. Some are very, very good at cosmetic surgery, some are good at reconstructive surgery, and some are good at both. So you start with a training program, you find Dr. X. Where did he train? Okay, he trained at Cornell, he trained at Johns Hopkins, he trained at Sloan Kettering. So it starts with a good training program. And then you look at how many years they've been out. Just because you're out 1 year doesn't mean that, you know, you shouldn't go to them. It depends on where they came from. And then you look at their board certification. Our board certifies us by looking at our cases, testing us to make sure that we meet their criteria. And then you go on to word of mouth is very, very important. Learning from another patient, hey, what was your experience with this doctor? And then lastly, I would say reviews. You know, reviews can be good or bad because they are the patient's true stories. And unfortunately, risk of complications happen. Complications can happen, and then one unhappy patient can certainly write a review. It doesn't mean that that doctor is bad or good, but you have to put it all into context.
Okay, and the after and also post-care follow-up and the reviews on that and word of mouth on that is important. You don't want a doctor who doesn't take your phone calls the next morning.
That's exactly true. I said above and beyond, your physician is who you sign the contract with. You sign this do surgery with Dr. X, and he should be the one responsible for all your care. Oftentimes there's a lot of people in the office, but at the end of the day, your medical question should be answered by your physician.
All right, let's talk about your volunteer work overseas. You travel overseas to perform cosmetic surgery, necessary cosmetic surgery for people who could never afford it, or at locations that have no skilled doctors to do it?
Yeah, so that tends to give us a different outlook in life. You know, we are so comfortable in the United States with our hospitals, our anesthesia, our supplies, and so we actually perform surgeries overseas, different countries. We are like a mass unit. We actually bring everything. We bring
You're a mash unit. You bring everything with you.
everything, and I love the show MASH. So we bring from every little detail, supplies to our surgical equipment, our anesthesia, our nurses and techs in the operating room, and we do a whole pre-screening first, a month before. Anybody who needs special testing, we get that done. We try to do safe surgeries, nothing that's requires blood transfusions or long hospital stays. We see them right after surgery. Sometimes we admit them and make sure they're 100% ready to go home. And then afterwards, we have physicians who take care of those patients for a month to 2 months afterwards. So it's a very controlled environment. If anything was to happen, our foundation would send someone down to take care of them.
What's the name of the foundation?
The Healing Hands Foundation.
And what kind of procedures are you performing?
So I do cleft lips, cleft palates, facial deformities for paralysis, tumors in the head and neck. We do burn reconstruction and hand reconstruction, whether it's you're born with 6 fingers or you were burned as a kid and never got any treatment and you have these claw-like fingers that need to be released. We also bring a pediatric surgeon down who performs hernias and congenital deformities in kids.
What are cleft lips? What causes them?
So cleft lips is essentially a lip that's not formed completely. It's not formed across the area. So that can be in combination with a cleft palate, which is, again, an opening. A cleft is essentially an opening. So kids are usually born for a variety of reasons. One, the biggest reason overseas is probably the lack of prenatal care. Folic acid is a very important medicine for midline fusion of oral structures, not just the lips. And then secondarily, there is a lot of ancestry going on, so a lot of inbreeding. And then the third is just a random mutation that can happen.
And the surgery is relatively simple, correct?
Yes. So surgeries
I don't want to say any surgery is simple, so excuse me,
correct.
but in the scheme of things, but they can't do it overseas. It has to be done by well-trained doctors.
Correct. Unfortunately, so the more you do, the better you are. I do roughly maybe 200 of these procedures a year. And so the procedure takes, a cleft lip can take 45 minutes to an hour. Unfortunately, their own physicians in country either aren't trained or aren't willing to help their own people, which is kind of sad. So we have a lot of missionary work going on. Cleft palates are equally hard. You really want to fix them the best way the first time, because if they have complications and breakdown, the other surgeries are much harder.
What kind of countries do you go to?
We go to Ecuador every spring, and then we go to Guatemala in the fall, in October.
And this really is life-changing surgery for these kids.
Absolutely, absolutely. It is, you take a kid who doesn't want to go to school because he has, you know, what we call the cleft or a hair lip, where he looks deformed, he's covering his lip with a handkerchief, and then you fix him and you can't even tell he had a procedure. Now they're going to school, you know, they're getting an education, they're going into the workforce. It is life-changing, not for the child only, but for the family.
Where do you do the procedures? Where do you set up shop, so to speak? And how do you attract the patients so they know that you're coming?
So we pick a location based on the facility. We need a structure. We need certain materials that we can't bring, such as an anesthesia machine, Bovie machine. We need electricity. It sounds so frivolous, but we need electricity. So
you need clean water.
Right. So in Guatemala, we partnered with a hospital that another mission had started building their ORs. And now we're 10 years straight. We have a chapter of our foundation in Guatemala. We've provided generators for them. We've built several operating rooms for them. And so the facility is just essentially grown because we continue to donate and build a facility. The surgeries are done by a combination of things. So we have the hospital and the surrounding mayors and the social media, newspapers and radio. They announce that we're coming usually a couple months before.
Okay, Dr. Flores, it's been a pleasure talking to you today. It runs the gamut from facelifts to missionary work.
Thank you so
You've
much.
got your hands full. I want to remind everybody to take a look at our website, allhealthallthetime.com. Some terrific information on there, information about today's show. I encourage you to please email us for questions for the doctors, as well as future topics that you would like to learn about. We're on every single day. We love to cover material you're interested in. That's the latest. Thanks for watching the Health Channel. All health, all the time. I'm Andrew Schmertz. Have a good day.